Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video where we have a 6-year-old child with really blocked ears, and it actually took me a couple of visits to remove this. It's not often that I have to get patients back, but in this case I felt it was the right option. So we're commencing with their left ear to begin with, and the patient's parents had been using some softening drops prior to attending, and although it softened the surface, more lateral wax near to the entrance, the main body of the wax plug was still quite hard, particularly in their right ear. That was the difficult ear, more difficult ear should I say. Now this child was crying during the procedure, and so to calm the patient down, his mother gave him an iPhone, is watching YouTube, and it did relax him a little bit on this side, but the right side, because of how hardened the plug was, the patient did find it a bit uncomfortable. So I stopped quite early on during the procedure, and I invited the patient back, and I've got that follow-up video at the end of this, so do stay tuned. So the left side, I'm bringing this main plug out. You can see they've got a bit of a narrowish ear, but given their ages, I wouldn't say it's abnormally narrow. And we're just wriggling this out. As you can see, it's been there for a while. It's quite dark. It's oxidized. Now, what I did with this patient's left ear, I got the majority of the wax out because I know they were a bit uneasy. I didn't want to prolong the procedure more than I had to. And after this second plug I removed, there was a little bit left on the eardrum, but the hearing was significantly improved. So I left that purposely to then commence with the right ear. I didn't want to prolong the procedure on the left ear because I knew the right one was the more tricky one. And of course, when you go close to the eardrum, there's more of a chance that the patient may not be cooperative. So I wanted to keep them cooperative for the right. We can see some of the eardrum. So there is some wax there. Now we do get that out, but at that stage I decided to halt and move over to this ear whilst we've got the patient on our side. And similarly to their left ear, the surface wax, because the drops had penetrated this, had softened it, but in a moment the main body, it was just too firm, and when I was making contact with this, there was just even the slightest contact, they were really finding it uncomfortable. And so I decided to stop because I wanted to finish off the left side as well, and I just invited this patient back after a week of using some more drops. And even then it was quite tricky, and you will see that procedure at the end of the video if you stay tuned. Now, with a child this age who is not still, I wouldn't dream of using any ENT micro instruments, if at all avoidable, because of course with any instrumentation there's far more likelihood of causing trauma compared to microsuction. And I just wouldn't have attempted it unless it was last case scenario, and this patient had to otherwise have a general anaesthetic to have the wax removed. And even then I would possibly, with this particular patient, consider using ENT micro instruments because of that risk, because they weren't stillers of patients. So I've decided to leave the right ear at that stage. I've just wanted to come back for this left ear, and I purposely used the fine end, so it's a lower suction, because obviously they could hear a lot better, and wanted to minimize the noise levels to keep them comfortable. So with the fine end it was still a bit tricky. I might have had to revert to the full sucker. Let's see, because I just don't think it was powerful enough. So I've still got the fine end here. We shall see if I had to revert to the full Zollner. So it's just come off the eardrum. I could see that, and I could remember when I was doing the procedure I felt it, but I've just quickly gone back in with the full Zollner at this stage, just because I just needed to get it out. I just don't think the fine end would have been powerful enough. There we are. Now there's a bit of wax here and there, but we're not too concerned. I think I managed to get that piece at the roof of the ear canal, but I just left the rest. I've just put the fine end back on. But yeah, we can see the eardrum. There's a bit of staining there. We're going to leave that. So this is a week later. This is their right side. And again, the surface was softened, but the main plug was still quite firm. However, some of the drops did penetrate deeper. So the problem with the original wax plug on this side, I suspect, was that the surface was like sandpaper, And when it's so dry and rough like that, first of all, you can't get a suction grip. And subsequently, when you apply pressure to get a suction grip, you may be inadvertently pushing this bit deeper. And if it was really dry, like sandpaper, it's going to be rubbing against the canal wall and the eardrum. So although it's still firm-ish, I think the perimeter is softened enough to take away that discomfort. Now, again, at times the patient was a bit uncooperative, but not like the first appointment. I mean, they were so good. I often wonder what I would be like if my ears were this blocked and I was this child's age, whether I would be able to sit as still as this patient. So they did remarkably well. Now, the long-term plan is I've just got this patient to just use some medical grade olive oil spray on a weekly basis. We just don't want it to get to this stage again because it was quite a severe impaction. And then going to return 6 months in the first instance just to analyse where we're at. And then from there, I can advise accordingly whether to come more frequently or less frequently. But hopefully, now that we've got this main plug out, that it will last a while. And this plug, it's just trapped deep in the ear. And because it's still a bit firm here and dry, it's hard to get a suction grip. So I'm just dilating open the ear. I'm just looking at the best method, and it's just trying to get some of this skin out of the way first, around the edge. I'm going to put some medical grade olive oil spray again, I think. You can just see how long it's been there, and you can see at the bottom where it's lodged beyond the isthmus. You can see the isthmus just to the right. With that, an isthmus is a narrowing. It's a medical term given for narrowing. In the ear, we've got two. We've got one near the entrance and we've got one a bit deeper near the eardrum. And this is trapped beyond that narrowing. So essentially, we're bringing a wax plug larger than the entrance or the part of the ear canal directly adjacent to it. So we're having to squeeze this through. So we've got probably half the plug out. I'm just trying to separate it from the front part of the ear canal. So when we're performing it, especially with this patient, there's always one eye, even if it's subconscious, because with the endoscope and wax scope, we've got full visibility of the patient. So even if I'm not directly looking at, obviously I'm looking at the screen, but your peripheral vision is keeping an eye on the patient just to see their movement, to see if it's really uncomfortable. And that's one of the advantages of having a portable system like this where the screen is right in front of you, because it does allow you that ability to keep one eye, as I said, even if it's your peripheral vision subconsciously on the patient, so you can monitor their comfort levels. So this is this last plug. I'm having to meander it around that front part of the ear canal to the right, because that's where it's trapped. So I'm trying to tease it out from there. And then once I've teased it, I'm kind of curving this around from, so at the moment on screen, from right to left, back to right. That's the curvature of the ear. I can feel it loosening. You can probably just see the eardrum in the distance around 6 o'clock, 7 o'clock, underneath that, the bottom of the wax plug. And this is that narrow section. So this plug is wider than this section. This is where it's getting trapped. So I think I'm going to go to the roof of the ear canal now. And put some more drops in. And that's just going to soften the surface. I can get a bit of a better suction grip. And it's also going to lubricate the canal wall. So as I'm bringing this through, it's going to reduce the friction. Similar to if you've got a ring stuck on your finger and you put a bit of soap around your finger just to lubricate it. Again, I'm just going to go to the top. I'm going to bring this down, trying to separate it. I've got to be careful though. I don't want to be pushing this further in. So I've got to, when I position the suction probe, but don't want to put too much pressure. I just want to kiss the surface. If I poke it in too much, I'm going to be pushing this back in. So it's just judging how much pressure to apply. And I just want to loosen it. And I think I do go back to the bottom where I was before to bring it out, but I could feel a bit of resistance at the top. So we'll just loosen that. I've got a decent suction grip now. I'm just trying to meander it around that curvature of the ear canal. I think the patient was feeling it at that stage. So I just came out, gave him a moment. Okay, I'm just going to that core, the middle section. I think that's the best place for me to get the suction grip. I'm slowly just teasing this out. You can see it's separated slightly, the wax plug. I think ultimately that's going to help me bring this out. It's the problem area is to the right, 3 o'clock, that's where it's trapped. So you can see how I'm arcing it, going left to right. So as I'm doing that, the end of the wax plug, beyond that anterior recess, is going to move from right to left. If I'm bringing this more forward section, left to right, you can imagine a plug like that. You're going to then be changing the orientation of the back section to kind of come away from that front part of the ear canal, which I think we've got now. So we're kind of essentially reorientating this wax plug in the ear. And now we're going to bring it away. But just going to be, I probably wasn't as patient. I need to just keep the sucker there for a bit longer just to get the suction grip. There we are. I think there's this little piece behind, so we're going to clear that. And then the eardrum looks nice and healthy, which you'll see in a moment. So it's a tremendous amount of wax. I didn't get time to take an image, unfortunately. I'm just going to re-enter the ear and see that the medial section is a lot wider. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.